You're watching Fox 11 News Special Report.
And good evening, and welcome to a special edition of the Fox 11 News Special Report. I'm Alex Michelson.
And I'm Marla Tejas. Look at the special guest that we have joining us in studio, Dr. Drew Pinsky. Welcome back to the show.
Such a privilege. I'm having a pandemic flashback, Alex, although we were separated by much more than 6 feet when we were last in the studio together. Of course, Dr. Drew was the original co-host of this show, which started as the coronavirus special report.
Right?
So much has changed. So much is still the same. And Marla, we've got an update, speaking of COVID.
We do. So that's what we are talking about first tonight. For an 8th consecutive week, LA County's biggest county hospital reports COVID numbers are trending down. Of 35 COVID-positive patients admitted at LA County USC Medical Center, 3 are there due to COVID, none in the ICU. It's something that doctors discussed on their virtual briefing this week and something I asked LA County Public Health about.
We continue to have virtually no patients admitted to the hospital due to COVID. This is a completely different phenomenon than what we were seeing last winter.
What is your reaction to that, and do these numbers square up with the hospitalization numbers that you present?
In general, our numbers are full county numbers in terms of all of the hospitals, but not surprised to hear that hospitals may have different experiences in terms of what they're seeing in terms of COVID patients.
What is your reaction to these numbers?
I am not surprised. It is a different time than it was when we were last sitting at the desk, that is for sure. And it's a reflection of both the fact that Omicron itself is usually milder, not necessarily milder, but usually milder, and that we have so many more options now in terms of treatment, and people are vaccinated. And although the vaccines aren't specific for Omicron, it gives us that cellular immunity that does reduce the risk of severe illness.
Well, that's something we will talk about soon, about that very specific COVID booster. In the meantime, the other thing that we want to talk about is how much transmission is happening across the United States right now. Yeah, let's look at a graph right now. This is current COVID community level in the U.S. Nearly 78% of the U.S. population is in a location with a medium or high level. This is what we call an endemic, right? That's exactly right. It's exactly what that is. And so we should get used to living with this, and thank goodness it's not a serious illness any longer. Not that it can't be again, and not that at-risk populations couldn't get themselves in trouble. So please do be very careful. Make sure you talk to your doctor about your risk. Make sure you take your vaccines. Make sure you have somebody provide you antiviral therapies if you get sick and you're in a risk category. But this is such a different thing. Endemic means it's with us. Most of us will get it, but it's not going to necessarily harm anybody, or very few. We escaped the LA County mask mandate at the end of July. That was almost 1 month ago. I know some people would prefer to have that mask mandate in place still. Where do you stand on that?
You know, the mask situation is pretty clear. You can't protect other people with a mask. You can protect yourself. So I always ask people to sort of imagine you're walking into a patient room with an infected illness. How would you protect yourself? Well, you'd put on a well-fitting N95, and you would not take it off, period. Not to eat, not to drink, not anything. So if you'd like to protect yourself, that is a way to do so. Doesn't transmit much outside, but if you're indoors and you're looking to protect yourself, that well-fitting N95 mask is still of some benefit. But in terms of protecting others, probably doesn't do much. And the studies are pretty clear on surgical masks and obviously cloth masks, not doing much.
Right.
Well, of course, when you were on the show with us, we went through your COVID experience with you. Yes. Since you've been on the show, Marla and I have both gotten COVID. Good times. We decided not to take Paxlovid because we didn't feel like we needed it, but there's a lot of people that are. An Israeli study of some 100,000 COVID patients is shedding light on Paxlovid, which is Pfizer's go-to COVID treatment. Research found that Paxlovid reduced hospitalizations among high-risk patients, so these are people 65 and older, reduces hospitalizations by 75% when given shortly after infection. However, no measurable benefits were seen in patients ages 40 to 65. Nearly 4 million Paxlovid prescriptions have been filled in the U.S. since the drug was authorized last year. We know the president took this. We know the first lady took this. The vice president took it. Did you take it? I did not, but I have prescribed a lot of it, and it works like a son of a gun. I mean, people's illnesses are cut right off as soon as you take it. But this study shows very clearly, in terms of the end point of hospitalization and death,
Paxlovid has a significant benefit in the over 65 age group, which is the main risk one of the main risk categories. Under 65 doesn't seem to be doing much in terms of reducing risk of hospitalization and death, although that's already very rare in those populations. But what is not answered yet, does it reduce the duration of the illness under 65? Does it reduce viral shedding? Does it reduce misery? Does it reduce long COVID or neurological symptoms? Those questions yet need to be answered. In the present moment, we don't know what we're doing. People are prescribing it, but we don't have science to know exactly what we're doing with it yet under the age of 65.
Well, and then there's the fact that it does present its own side effects as well.
Oh yeah, oh yeah. I've seen a number of cases of rebound, much like the First Lady and President had. I've got a lingering concern. Now, this is not in the science. This is my own personal concern. I've noticed that when people, including my own daughter, take Paxlovid, sometimes they seem to get a second, not a rebound, but a second infection of Omicron very soon. They should be immune. Paxlovid may change the way our immune functions in terms of protecting ourselves once we've been infected.
What's the time span that is considered a rebound case?
Right away. It's like
Instantly.
within days.
Within days.
Just,
okay.
It happens very, very quickly. It's certainly within a week, I would think.
So you mentioned the very specific COVID booster that's coming our way. So this new COVID booster could be available in just within the coming weeks. About Labor Day, Pfizer and Moderna have both asked the FDA to authorize modified doses which target the Omicron subvariants BA4 and BA5. The shots combine mRNA from the original COVID strain with spike proteins from those Omicron subvariants. If approved, the White House hopes the booster could blunt a possible winter surge. Still unclear, though, who will actually be eligible and how much will they help. There's a big swath of people who didn't get their initial booster and have been waiting for this specific one.
Yes.
That's a good idea.
If you are in a risk category, it's a great idea. I do a lot of geriatric care, and I'm boostering up my patients like crazy. Many of them have come to me since May and June asking, should I get that next booster? And I've been telling them, let's get, you're already boosted up twice. Let's get the Omicron booster the next time around. The issue with the vaccines such as they are is they don't give you what's called humoral immunity against Omicron, which is antibodies against it. But it does cause some cellular immunity, which is those T-cell armies that can come out and reduce the significance of the infection. So it reduces the seriousness of it. So there's some benefit for Omicron, even with the old vaccines, but there's no Omicron-specific ability to fight. And that will come with this new vaccine. Now, who exactly should get it? Please talk to your doctors. These are not clear navigations. These things have to be navigated on, I think, on a case-by-case basis.
All right, so in addition to the COVID stuff, we know something you're really passionate about is the issue of homelessness.
Oh, yeah.
And just today, Governor Gavin Newsom was here in downtown Los Angeles, visiting a first-of-its-kind pilot program to deliver services for the homeless. This was just steps from an encampment in downtown LA. It's sort of a pop-up. It delivers health screenings, counseling, COVID vaccines, a DMV location to help people get IDs as well.
This is not one-off. This is not an exercise to celebrate one day and done. This is going to be made habitual in this state, and I expect all state agencies to begin to look anew at how they govern. Not behind doors, not on Zoom, but out on the damn streets. You spend enough money of your tax dollars for us to be now accountable to actually addressing the reality, the lived reality you experience every single day, particularly down here in Southern California. So
we know that so many of these services traditionally are done by the county. And one of the things the governor was saying out there with us today was some counties aren't doing what they need to do, so the state needs to step in.
Fine. Listen, you know I've been frustrated with his homelessness response, but he gets high grades from me in terms of most improvement. He's getting around to really understanding what this thing is. In terms of giving out safety measures like naltrexone and things like that to help people clean needles, yes, of course. Good for him for doing that. The bigger issue is about what do we do, how do we get people into treatment, whether there should be safe injection sites. He recently did not sign a bill, which I think was a great move, not because injection sites are bad per se, but because if they're not managed a certain way, again, you can end up with really serious outcomes.
Well, and on that issue of homelessness and drugs, one of the things that they're handing out at this pilot program is overdose bags. He held that up at one point. This has fentanyl test strips. It has other things that you can use if you have an overdose. So I asked him, what goes through your mind, the fact that we have to hand this out to everybody on the streets? Here's what he said.
I mean, this is a symptom of our failure, not our success. Look, is reality. Reality is reality. You got to live with the world that you're dealt, the hand that you're dealt, and That's why harm reduction matters. Many lives have been saved by this simple thing of handing out these kits. And we're here to save lives. We believe that every life is precious.
Yeah, I'm always stunned when people object to naltrexone being used or handed out. That's bizarre to me. What other illness do you just let people die from?
Is that Narcan?
Narcan, I'm sorry. It blocks the opioid receptor, so people wake up from an overdose. But there's a bigger problem here, and this is the part I would like Governor Newsom please to address, and that seems to get missed. So the fact that he didn't sign on to this safe injection site thing leads me to believe he may be coming to this reality, which is that addiction is a progressive illness. Even if you give people safe injections, they still progress. This is a progressive illness that ends in death. And no matter what setting it's in, if you don't prepare for that, if you don't get people moving towards some kind of a recovery or real serious treatment where they're moving from progressive illness back to some sort of health, they're going to die, no matter what you do. And that's where people have to come to
And part of the announcements they made yesterday is $83 million in social services for people that are moving into some of these different temporary and permanent housing to try to help them with a lot of the stuff that you're talking about.
I hope so. We've been living in a sort of a zero-gravity world here in Los Angeles where nothing is asked of addicts. You must ask them to do something. It's important to them. It's important to their recovery. It's important to them getting better. Even if it's just following a medical regimen, asking nothing will result in demise.
So if a safe injection site came with those outreach services,
I wouldn't object. There have been drunk houses around for years. People give alcoholics all the alcohol they want, provided that in that environment there's a group of people there using motivational enhancement to get them into recovery. It tends to work.
It's not just come up here, you can get high, come back tomorrow.
That's demise. That people die that way. Not because they're living their best life, because this is a progressive illness. People have to come to terms with that.
Well, and I asked the governor yesterday, do you support the concept of the safe injection site? And he said yes. I don't support the plan, but once we get more plans, more details about what we can do, then he supports going back to this. So we'll see.
Fair enough.
We have more with Dr. Drew, because we can't get enough of Dr. Drew, right?
I can't get enough of you guys.
On what he's been working on.
Yeah, up next, though, Vanessa Bryant awarded $16 million by a jury. There are reports the money will be donated. Who will benefit?
Back with Dr. Drew Pinsky, back in the house, of course, the original co-host of this show. Great to see you in person. We have a new studio since you've last been here.
You do. It's beautiful.
And your shoes are impossible to fill, by the way.
Yeah.
Go ahead.
Stop it.
Stop
it. I am just so excited to be sitting here with you guys. You don't even understand.
So talk to us. What are you up to these days?
Well, I think I had to create a new special show for Fox 11 where the three of us do something.
Yeah.
Let's just do something every night. I miss this so much. I didn't realize, and I miss you guys. I've been doing a lot of different things. I do a lot of digital media. I do a streaming show on Tuesday, Wednesday, and Thursday at 3 o'clock. I do multiple different podcasts on different platforms. I live strangely. There's my own podcast by myself, but I strangely live in a place called Your Mom's House with Tom Segura and his wife. Comedy World. How I got there, I don't know. But the streaming show, that's the Ask Dr. Drew. I think you guys would enjoy that. We just do an hour of interviews and taking calls.
I just got confused. I thought you were moving in with my mom. I'm like, what's going on here?
That's so funny.
Her brownies are good, by the way. Yeah. Topics, wide-ranging.
Wide-ranging, all over the place. You know, I see stuff on the internet that interests me, and I want to talk to that guy, and we get him, and I talk to him. It's been kind of interesting. I also have done a reality show that's going to air here on Fox. I'm not at liberty to really give details, but it's...
You're downplaying it right now, by the way.
I am. It's a major fun thing. It's gonna, as soon as I can talk about it in detail, I promise you I will come here and talk about it. Me and a bunch of celebrities had an extraordinary experience together.
Yeah. So it's somewhere out of the country?
Somewhere out of the country. I'll tell you that. Somewhere out of the country. And I'm not sure if it's going to be fall or around the Super Bowl or somewhere in there. It's kind of... Why are you sighing, Marla?
Because I want to know.
It's going to be the Super Bowl halftime show, right?
That's what it's going to be. It won't be all out there. Well, I tell you what. Another thing that's happening at this point in my life is I'm really valuing relationships, everybody. Gratitude, relationships. We've talked about these things over the years. I value you guys, but having been into a traumatic experience with a bunch of celebrities, we're all very, very bonded up. We talk every day, and that's been really a blessing to have another set of friends in my life.
And just getting back to, you know, the fact that you were here, you started with the coronavirus pandemic, and the state of the pandemic now, I mean, you just see this as an endemic.
Yes, it's an endemic illness.
Yeah.
It's so different. Look, there are several things that stand out about, you know, when Alex and I were here we were moving through it we didn't know. It was all just all a cloud of fog of war. But I do stand out that one night that you had the school board member in here, and I just kept going, Nick Malvoy. I kept going, why are you closing why are you doing this? Who told you? I revisited that video, and it was like, because the CDC, now when Dr. Fauci said I didn't tell people to do that, he didn't. It feels like it all got laid at his feet, but he didn't recommend that.
And he's on his way out.
Are you going to miss him?
You know, he's been with me my entire career, and as you know, I've been a fan forever. And whatever I got wrong about the pandemic, I always say, just look to him. You should be your North Star. So he got most of it.
Well, it's great to see you. Let's do this more often.
Yes,
Dr.
please.
Drew is all places, all the time. Just look him up on his website and get more information on all that. Great to see you.
Thank you.